there are several available tools for calculation of cardiovascular risk, and one of the tools that's currently available is the Australian National Heart Foundation risk calculator, which is available online, but most doctors should have access to this calculator. So what I'd like to do is to illustrate how a doctor can calculate risk for over a 5-year period. So let's give you an example here. So obviously male, let's pick an example where the age is 65 and they present to their local doctor with a blood pressure of about 165 when checked. Now that's the top reading, but that's the reading that is used for our calculation, that top reading. Let's say that they're a current smoker, and that when their blood test is done, their fasting blood test is done, their total cholesterol comes back at 6.5. Certainly I see a lot of men with cholesterols around that level who are not currently treated based on just that assessment. But when used with other assessments, it gives us a broader picture. So let's just continue. Let's say that their good cholesterol is a little bit low at 0.8, that they don't have diabetes, thankfully, and that they've got no evidence that they've got thick heart muscle on a simple ECG tracing of the heart. Now, based on that information, their risk over a 5-year period is 37% for stroke and heart disease. Based on that risk, you certainly want to aggressively treat those factors of blood pressure and cholesterol. Let's see what happens down the track a year later when that person is reassessed on medical therapy with lifestyle changes as well. So we've moved 12 months down the track. They're on good treatment for blood pressure and cholesterol. They're now 66 with a blood pressure which is now lower, top reading 125. They've stopped smoking through concerted efforts. Their cholesterol is now lower. Total cholesterol is now lower. Their good cholesterol is now higher through diet, exercise and cholesterol medication, now 7%. So you can see based on this risk calculator that the chances of getting stroke and heart attack have been significantly lowered. So I hope that this illustration shows that for an individual, by consulting your doctor, having your doctor assess your risk and treat risk factors fairly aggressively, you can see the benefits there of reducing your individual risk.